Everybody. Today I want to talk about leaky gut syndrome, more appropriately named increased intestinal permeability. Essentially, what you should know is that in our small intestine, where the majority of absorption takes place for nutrients, we have what's called gap junctions between the cells in our small intestine. And so there's a design such that certain size of particles, small particles, after being digested through our digestive system, we chew our food, saliva mixes with it, goes into our stomach acid interacts with it, gets into our small intestine, and then you have the secretions from the gallbladder and liver with bile breaking down fat, and enzymes from the pancreas breaking down the food even more so. And so in the smaller particles, then they are absorbed through the small intestinal wall. Now, if you have an unhealthy intestinal wall, you absorb larger than normal molecules. This includes bacterial endotoxins, as they're called. And so there's certain types of bacteria, or the toxic shells of them, if you will, that are absorbed through the intestinal wall and get into the bloodstream. And so the problem when you have an unhealthy intestinal barrier and you're absorbing molecules that you shouldn't, your immune system's going to react to them as it should and sees them as foreign invaders, and that releases a cascade of inflammatory reactions, inflammatory chemicals. And so that's why it can lead to things like joint pain, muscle inflammation, brain fog, increased autoimmune risk, things of this nature. The other problem when you have an unhealthy intestinal wall is that you're also going to have problems with your immune system directly. We know that about 70% of our immune system function originates in what's called the gut-associated lymphoid tissue. So a lot of our immune power actually comes from our gut. And so if you have, say, chronic infections in your gut, maybe you have a parasite, maybe you have dysbiosis, overgrowth of certain bacteria, maybe you have small intestine bacterial overgrowth, where certain bacteria have overgrown, fermenting food, creating malabsorption, making for an unhealthy intestinal wall. That's going to lead to problems. And so as a result of having an unhealthy intestinal wall, it can basically lead to all sorts of things. Fatigue, for example, would be very common. You don't absorb your nutrients properly. Inflammation, like I talked about. It can affect your skin. It can affect your joints, brain function, like we talked about, mood, basically everything. And so a lot of Americans, because of their diet, high in simple sugars, carbohydrates, lack of fiber, they have unhealthy bacterial balance in their small intestine. And that's setting you up for a problem with your intestinal absorption. As well, the medications people use. If you're using things like acetaminophen, ibuprofen, these types of commonly used over-the-counter pain medications damage the small intestinal wall, especially when used long-term, which a lot of people do. So you should be aware of that. People under high amounts of stress, that decreases circulation to your gut wall. And the health of your intestinal lining, which is constantly replacing itself, is highly dependent on the circulation, bringing in nutrients to help restore and help to replace the intestinal cells with healthy cells. And so all these factors are big problems when it comes to intestinal health. We have found with many patients at the Stengler Center for Integrative Medicine, we do a blood test, and we actually can get a rating of how your intestinal health is. How do we do that? Well, we know because, again, there are certain bacterial endotoxins which should not absorb through the intestinal wall. And if they're at elevated levels in your blood, that's showing you have intestinal permeability problems. As well, we can measure other proteins which the body releases to try and heal up a leaky gut, and then those levels will be elevated as well. So we do have the technology to see what's going on with the patient. After we change their diet, get them on a healthier diet, high fiber diet, high in good fats, get them off their food sensitivities, give them nutrients which help with small intestinal wall healing, and that could range from things like D-gel licorice, aloe vera extract, and acetylglucosamine, as well as many others. You can establish good health to the intestinal wall, and that can pay great dividends in your systemic health. So I hope you found this helpful. If you'd like more information on our clinic, go to markstengler.com, and there you can read about the different doctors at our clinic and the different types of treatments that we offer.